Welcome to the Commune podcast. My name is Jeff Krasno. Today I'm joined by Dr. Judith Joseph. Dr. Joseph is a board-certified psychiatrist, clinical researcher, and best-selling author of High Functioning: Overcome Your Hidden Depression and Reclaim Your Joy. She is also a clinical assistant professor at NYU and serves as chair of the Women in Medicine Initiative at Columbia University. Her groundbreaking work has brought high-functioning depression, which she calls the hidden epidemic of our time, into mainstream awareness. In her book and her research, she explores how countless people who seem to be thriving outwardly, always busy, always productive, are actually struggling inwardly with anhedonia, the inability to feel joy. She makes a crucial distinction between happiness, which is fleeting and external, and joy, which is deeper, steadier, and rooted in connection, values, and meaning. As you'll hear in this conversation, we dive into the landscape of hidden depression, how trauma, both big T and little t, shapes our emotional lives, why imposter syndrome can keep us from naming our suffering, and how social media fuels the endless comparison that steals joy. And most importantly, Dr. Joseph shares her powerful 5 V's framework: validation, venting, values, vision, and vitals, for reclaiming joy and moving from mere functioning to flourishing. This is a practical and compassionate discussion that I think will resonate with anyone who has ever felt that they had to hold it all together while quietly falling apart inside. And now, my conversation with Dr. Judith Joseph. Okay, Dr. Judith Joseph, what a treat.
Well, thanks for having me. It's nice to meet you.
Yeah, great to meet you. I love meeting a doctor who's writing best-selling books and appearing on podcasts, who's actually also seeing patients. So well done. I'm looking. I'm actually learning so much from you. I mean, before we jump into the blood and guts of the interview, I was checking out your Instagram, and I learned what whining was. That was key. So you just hit up the West Indian Labor Day Parade. I used to live in Brooklyn for many years. And I just always remember that being really fun. So, and not disconnected from mental health, right?
No, not at all. Whining is that rhythmic side to side. It's the dance that they do. And during Carnival, which is a really celebratory time in many different Caribbean countries like Trinidad, where I'm from, whining is the staple dance. So anyone can whine. You just have to move your body, your hips side to side, and it's quite pleasurable.
Right. I've raised 3 girls, and they're all dancers, and I prefer that form of whining than the early age form of whining. But and we're all music lovers. I'm sure they would love to see me whine. They love to make fun of Dad. So there we go. I also learned what a labubu was, and you've been very busy in New York. I love that you're kind of taking in all of the different things that New York has to offer culturally. So you were out at the U.S. Open. I'm a tennis player, so. Yeah, and you write about Naomi Osaka in your book, but you taught me what a labubu was. What is a labubu, and what does that have to do with mental health?
So my daughter actually was the one that gave me a whole education on labubus,
Okay.
because I had no idea what she was talking about. And she was like, I want a labubu. And I was like, what is that? So she broke it down for me. There are these collectible items that are supposed to bring you joy, and I don't personally think that they're very cute, but she loves them. And when I saw Naomi Osaka with I think it's like a crystal encrusted labubu at the U.S. Open,
Yeah.
I thought, wow, like, she's using it possibly as a transitional object. And in my book, I talk about transitional objects in psychiatry. When people go into the hospital, especially if they're having, let's say, an emotional breakdown, we encourage them to bring something in that reminds them of happier times, that is something concrete that they can hold or look at to remind them that they have something to look forward to. It's often a picture of loved ones or a soft blanket or some object that reminds them of like a joyous time in their lives, and they keep it at their bedside or, take it with them to group, sessions to remind them that, there's hope and that
Mm,
things will get better. And often in outpatient practice, we recommend to patients to keep a transitional object in their purse at their, place of work when they're feeling overwhelmed or they're feeling as if, they're empty, to look at this, object, hold on to the object, use your senses, and use this very physical, literal thing to keep you grounded. And when I saw Naomi Osaka's Labubu, I thought, wow, I wonder if
mm.
that's her transitional object because she's very open about her mental health.
That's right. Yeah, yeah, she is. Well, it certainly seems to be working for her this year. She's progressed very far in the tournament. She had a big win over Coco Gauff, which was, very prominent match. So good on her for being able to normalize and destigmatize conversations around mental health related to sports. And I think that's we've seen that more and more in professional sports, and I think it's a good thing.
Yeah, we don't often think of these athletes as being at work, but I will use these examples and I'll say, listen, they're at work. This is
Mm,
their place of work, and they deal with conflicts at work. They deal with performance issues, self-esteem issues. But the difference between them and us is that it's on this like amplified, magnified level where everyone, has a view of what they're going through versus when we're at our workplaces, maybe a couple of people see what's happening, but they're completely exposed. So we could learn a lot about mental health in the workplace from these athletes because they are working and they're having these conflicts and they have to resolve them in real time. So there's a tremendous amount of pressure for them.
Yeah, I'd never really thought about transitional objects that way before. My middle daughter, who's a bit of an empath, a few years ago gave me a stone heart that she sort of had polished down, and it fit kind of right in the little pocket of your jeans. And I used to have a lot of anxiety going to meetings and being sort of in enclosed spaces in high pressure situations. And I always kept that in my little pocket, and I feel it, and it would kind of induce a sense of calm and perspective. So I think that's great that there's a name for it. I didn't realize there was an actual clinical name for it. Yeah.
I encourage my patients to hold value stones. In my book, I talk about
Mm,
values and anchoring yourself, to things that are actually meaningful and give you a sense of purpose. And with my patients, they'll write their values on these stones and keep them in their
mm,
purse or at their desk at work, and then pull out that stone and look at it. So a typical word that's on a value stone is family or faith or nature. And then, when you're feeling overwhelmed, okay, well, maybe I need to reach out to my family, or maybe I need to go for a walk in the park, things like that that really allow you to feel rooted in something that brings you meaning and a deeper purpose. But yeah, transitional objects are things that you can be creative with. They could be something religious or spiritual. The point is to have that very physical reminder of what's important.
and apparently they can be Labubus too.
Yes.
Okay, so here we go. So I'm no epidemiologist, but after reading your book and listening to many interviews with you, I think you really identified a mental health condition that is just so astoundingly prevalent in society. And as I was thinking about it, like I just don't know that many people with clinical bipolar disorder or schizophrenia, but I personally know hundreds and hundreds of people with HFD, with high functioning depression. And this is not a condition that had existed really in the DSM. So maybe we could just start by, you just defining kind of more broadly what is high functional depression, and how did you come to actually identify it and put your thumb on it?
Yeah, well, high functioning depression is not in the DSM, but clinical major depressive disorder is. And in my clinical research study, we looked at people who had symptoms of clinical depression. So these are things like problems with sleep, problems with concentration, feeling guilty or having hopelessness, changes in your appetite, changes in your energy, anhedonia, low mood, all of these symptoms of depression, but they were not breaking down. So, in order to meet criteria for clinical depression, you have to either have these symptoms of depression and break down, like lose functioning or have significant impairment in your functioning, or be in significant distress. But what I was noticing was that people were having these symptoms, but they weren't breaking down. In fact, rather than breaking down, they cope by overproducing, by overworking, by pushing down their feelings and instead working themselves to distract and avoid from dealing with the feelings. And they weren't necessarily people who were accustomed to talking about how they felt. So it wasn't as if they were in distress, they were acknowledging it. And so I wondered, well, how many people are like this? And, personally, I was going through something similar to what I'm describing in 2020 when I was, busy, had a young child at home, had a partner who was a frontline worker, had this clinical research practice where my patients depended on me to stay on these medications throughout the pandemic. There was a lot of uncertainty, and I was having all these symptoms of depression, but I was over functioning. I was like the one on TV helping people through the pandemic. I was, killing it at work, but I didn't realize that it was actually killing me. And so I wondered how many people are just like me. So I set out to write a protocol to try and capture this experience because it had not been studied. And what we found was that a lot of folks who cope with these symptoms of depression, not by shutting down, but by overproducing, by being pathologically productive, a lot of these folks were actually trying to outrun negative emotions and past pain. So rather than processing what they were going through, they were trying to busy themselves to avoid acknowledging what they were going through. And, this study, the first in the world, we didn't know at the time until we got it published, and they were like, there are no other studies in high functioning depression. And, it's something that needs to be repeated. It's, the first one done, but I think that this initial study is eye opening because having that correlation between trauma and overworking to cope with negative emotions is something a lot of people can identify with, but there was never a term to describe that until now.
I think having some language or verbiage to be able to describe it is just helpful in and of itself. Because for me, as I was looking in the mirror deeply, I saw so many aspects of HFD. I know that there's a lot of different kinds of types of people that are at risk for it. But for us who are like podcasting and writing books and having families and running businesses, etc., there is sort of this insidious built-in reward system for busyness and productivity, such that we often don't really need to confront deep-seated trauma and feelings. Is there a portrait of someone who suffers from HFD, or is this kind of just so many different people can fit the diagnosis?
I'll often use examples of someone like the professional athlete, but the working mom, or the working parent, the entrepreneur, the immigrant student, people who don't feel comfortable slowing down because they are afraid of what happens if they actually face their pain. They don't want to let others down. They're the rock, right? And so I often use these caricatures, but really anyone can have high functioning depression. If you want to wonder about whether or not you have it, I say the red flag to start with is anhedonia. Anhedonia is a medical term. It's been around for ages. And it literally means a lack of interest and pleasure in things that once brought you pleasure and joy. And it's not something that's a crisis per se. It's not something like a suicidality, but it is an existential crisis. Lacking joy is a problem. And many people walk around feeling meh or bleh, and they're just like, oh, well, that's life. Well, no, it's not life. We were built with the DNA for joy. We're supposed to have pleasure in these basic human experiences. So if you're someone who's, like wakes up in the morning and you don't feel well rested, or you're eating your food and you're not excited about it, it's not tasty the way it used to be, or you're talking with your loved one and you're not connecting the way that you used to. Even with your pets, you're just not enjoying those interactions. These are all the basic points of joy that human beings are supposed to have. And lacking that joy could be a red flag that you're having anhedonia. Anhedonia is something that we found in the high functioning depression study that we conducted. And when you think about it, if you're not accustomed to processing your feelings, your negative emotions, and your coping go-to is to push it down, well, eventually the way that you push down your emotions that are unpleasant may lead you to start feeling numb to the emotions that are pleasant. And when you start to feel those, negative emotions, the things that you're afraid of, and you start to allow yourself to acknowledge what's happened to you and what you're going through, that may be the first step to actually starting to feel that joy again.
Yeah, I can see that. I mean, one way to deal with negative emotions, you become sort of disassociative, right? And then you just plow forward. And you're just like, okay, I'm just going to keep checking things off my to-do list. But as you say, that can result in this feeling that we sometimes refer to as meh, right? But it's sort of this uninspired state of being that we can confuse with kind of stoicism almost, or this kind of, or this sort of an unflappable emotional state, like I'm good, I've built up this sort of armor of defense mechanism, so I'm not susceptible to fluctuations in emotion and stuff, and that I think can be really have very negative consequences for the reasons that you point out. I mean, this concept of anhedonia, it really got me thinking a lot about how I experience or don't experience joy, and the delineation between joy and happiness, if you will. I don't know if you have specific thoughts about that delineation. I'll share mine, but I'd love to hear what you think about it.
Well, our thoughts are probably very similar. The happiness paradox is that, you hold your breath for this idea, for this thing to happen. When I have a private practice as well as a research practice. In my private practice, when patients come in, I will tell you the number one thing that they say on the intake is, I just want to be happy,
Universal.
And yes. And then I'll say, well, what does happiness mean to you? And a lot of times people don't know. They will be like, they have to really think about it because they don't really know what happiness is. They just know they want it. And when they try to explain what it is, they'll say things like, okay, I'll be happy when I finally have, a job, or I finally get into college, or I finally have a partner, or I finally pay off my debt, or I finally have a family. It's always this thing that's external that happens, and then they're happy. But what we know from research is that even when you get those things that you've been holding your breath for, you're still unhappy. So it's then something else.
Yeah.
Versus joy, which is something that I study in the research practice, is very different than happiness. In fact, on the clinical studies for depression that we do as a team, we add up all of these experiences of joy in order to determine if someone's becoming happier. So, for example, I'll ask them things like, when you took a nap, did you feel refreshed? When you ate your food, did you have an appetite? Was it yummy? Was it delicious? When you were feeling really, really tense, were you able to self-soothe and relax? When you were feeling lonely, did you feel connected when you talked to your loved one? And then we add up all these points of joy. And then we can determine if someone's getting happier or becoming unhappier, depending on the math.
Mhm.
And it's just so interesting because in the real world, people, they're like, I'm holding my breath for happy, this external experience to happen. But in the research, we're trying to add up these little points of joy that we always take for granted. We don't, I don't, think that before doing research, I ever thought about like sitting and savoring my meal and tasting all of like the ingredients. But now as a researcher, I'm like, I'm going to sit here, I had a mushroom sandwich for lunch and I was like, wow, I love these peppers. Like I'm really intentional
Mm.
about these little basic human joys because I know that when you add up those points, that's what leads you to being happier. So think about joy as this experience that you cultivate from within and happiness as this idea that's outside of you, that something else has to happen externally for you to achieve it. Whereas joy, if you get into certain practices, you can cultivate it and it is sustainable because it is internal.
So interesting. There was this study from Harvard a number of years ago. I think it was Matthew Killingsworth and somebody, Gilbert. And they did a study on human happiness. And one of the things that they found was the happiest people spend more time thinking about the thing that they're actually doing. So this yoking of action and intention. And it's really funny because my daughters are all dancers and their happiness is often very conditional when they're talking about dance. Like, oh, we're going to a dance competition. And it's like, if only and only if I get, the elite platinum and win first prize and get the trophy, well, then, it'll all be worth it. Then I'll be happy. Of course, the second that they get the trophy, there's another glittering object appears on the horizon. And I try to remind them that no, actually the joy is in the dancing itself. Because when they're on that stage, truly inhabiting that present moment, does the inability to experience joy, is that related to our inability to inhabit the present moment?
I think it is. It's really difficult to squeeze as many points of pleasure out of an experience if you're so distracted and if you're so busy. And so, there's an interesting study from earlier this year that came out where they took people who were 18 and older, so adults, and they took their phones away from them and they changed the phones to make them like not have that smartphone capacity. So they're essentially like a flip phone. And what they found was that after 2 weeks of having basically a flip phone, people's happiness points improved as if they were being treated with an antidepressant. And I found that very interesting because when you look at the discussion at the end of that paper, they said things like, well, people were saying they were sleeping more, right? It makes sense. Remember the point of joy that I talked about that we measure sleep? When you wake up, do you feel refreshed? Well, they were getting more sleep. They were being connected to their loved ones more, right? You're not on your screen, you're talking to a loved one, you're holding their hand, you're really engaged in that moment. They were in nature more, so they were experiencing that sense of awe. They were eating their food and tasting their food instead of being in front of a screen. Like all of these pleasures, they were getting the basic joys. So it looked as if they were being treated with an antidepressant when they weren't. Their scores reflected becoming happier because they were more present and intentional in these moments of joy.
It's interesting. There's so much talk about the overuse of social media and technology among children. And Jonathan Haidt obviously has been talking about this, just prolifically and eloquently, and I think it's great. But there hasn't been as much discussion around the adult use of social media and technology. And that might be even more prescient related to high functioning depression. Is that right?
Yes, that is absolutely the case. I remember during the pandemic, I gave so many talks about Zoom fatigue. Everybody wanted an expert to talk about Zoom fatigue because we were all experiencing it. Even as a therapist, I was experiencing it because we saw a lot of our patients on Zoom. And there's a center at Stanford dedicated to Zoom fatigue. And I remember looking at their data and they were saying things like people are not supposed to be looking at themselves as much. We're not supposed to be looking at our face while we talk to other people's faces. We weren't designed for that. We were designed to look at other humans, not see what we look like, but we were supposed to be like connecting with other people, looking at their hands, looking at their eyes, seeing if they were safe, seeing if they, were responding well to what we were saying. But instead, we're now focusing on looking at ourselves and other people. So what that does to the brain is that it just exhausts us, and it causes us to not focus on others and instead to
Mm,
scrutinize ourselves. I
mm,
catch myself doing this when I'm on meetings, virtual meetings, and I'm looking at my hair and I'm looking at whether or not I drew my eyebrow on right that day. I'm like distracted, and we're just not supposed to be thinking that way. We're
yeah.
supposed to be looking at other people, engaged in what they're doing. We're also not supposed to be looking at 10 people, 5 people at the same time. So even our interactions have become just overwhelming. So of course we're feeling meh and blah. It's just too much on our systems. Um, and so, technology and the way that it impacts adults needs to be studied more. And also we need to, you know, take the time, and the onus needs to be on us to learn about the research because it's happening. It's out there. We just don't know it because it's more provocative to talk about children, but we are being impacted too. When you're on your virtual meetings, don't look at yourself. Explain that I got to be off camera. I can't look at myself, and see how you feel after a week of not looking at yourself so many times. And many of them will say, this really worked. And it was a small intervention, but it really went a long way. And I tell you, every single time I do that, people are like, I'm going off camera too. I'm going off. Like they were just waiting for that permission. Like, I don't want to be on camera either.
Yeah. So, what relationship does trauma play with HFT?
Well, trauma is something that is very controversial because some people will say, oh, it's overused. Everyone's triggered by everything these days, But when I explain trauma in the research study, we separate the two. We have, and this has been used aside from my study, but big T and little T traumas. So the big T traumas are things like, severe life threatening events or assaults. And the little T traumas are things that may not be life threatening, but they still impact you in terms of how you view yourself, how you interact in the world, how you perceive the world. So things that aren't typically captured on trauma inventories, like, have you ever been through a period of where you didn't have food to eat, or, were you ever discriminated against because of, who you loved, how you looked, and, did that get in the way of certain opportunities for you and so forth. So these are painful experiences that have shaped how you view yourself, how you interact in the world, how others view you in the world, but they may not necessarily meet criteria for a big T trauma. Things like, bankruptcies, uh, really bitter divorces, you won't find that in a manual for PTSD. They just don't include those traumas. And I was really getting frustrated with, seeing trauma patient after trauma patient, and they would describe to me these terrible events like, I was in this toxic relationship and my partner withheld funds from me and I didn't have any money and I didn't know where I was going to live. And I'd have to say, I'm so sorry, but that doesn't meet criteria for trauma according to this PTSD study. And they'd look at me like, like I was crazy. And then after the recording, I'd say, listen, I believe you. But according to the, the textbook definition, you don't meet criteria, but I believe you. I know this is traumatizing for you. So I had to include all of these type of traumas so that I could like really capture the human experience and possibly painful situations that people were running from and using work to escape from.
Yeah, I feel a little sense of imposter syndrome when it comes to trauma because, I look around the world and I see what's happening in Gaza and Ukraine, etc. And I'm like, oh my God, that's trauma.
Mm.
My parents got divorced and I couldn't save it. But that's not really trauma because look around. If you're not starving, you always had food on the table. I spent a few weeks in Sloan Kettering Cancer Center as a 13-year-old in the pediatrics ward, but I'm fine. Like I got out okay. Those kids that didn't make it, that's trauma. And so I don't really validate my own sense of trauma. I kind of discount it. Um, but when I'm honest with myself and I try to do some sort of biopsychosocial analysis of my own life, which is not always easy, I became this consummate perpetual people pleaser as a product of some of these experiences, but I don't really give myself full credit for the trauma. Is this something that you often see?
Yes, and those traumas that you listed out that you tend to minimize and you have imposter syndrome about, those are actually traumas that are listed in the adverse childhood events questionnaire. So, the divorce of a parent, a serious childhood illness, those things are actually captured in studies, and they're validated to possibly lead to worse outcomes as an adult in terms of like your mental health, your physical health, your socioeconomic status. So those are very real traumas, but they're not listed in the textbook for psychiatry, like the DSM-5, the one that we use to classify trauma. So, there's been this movement to try and understand how these very painful past experiences do impact you. And so they may not be the big T's, but they're the little T's. And yes, that one of the symptoms of trauma that is often overlooked is that internalized shame, blame, feeling as if, well, why am I complaining? It isn't so bad. That's minimizing of what happened to you. All of those things may be trauma responses, in addition to that unworthiness leading to people pleasing, bending over backwards. Uh, Something that like pop culture refers to as like the fawn response, like,
Right.
some people go into fight, some people go into flight, some people go into freeze, but others go into fawn. And they become, you know, they feel so unworthy of their own acknowledging their own emotions and experiences that they primarily focus on other people and they end up people pleasing. I talk about that a lot in my book, because I think a lot of people with high functioning depression are people pleasers. They tend to be givers and not takers. And it's human nature that if you're giving, people will take. And over time, if you've learned that that's how you have learned to earn your love, and that's the only thing that you believe makes you worthy, then you won't change because that is how you see yourself fitting into the world and into other people's lives.
I've had a number of conversations with Gabor Mate, who I'm sure you're familiar with. And he has a certain definition of trauma that has become a popular definition. And I want to see if you're on board with this, because I think some people are critical of it. So he contends that trauma is not the event itself. It is really the ongoing emotional response to the event. And this is where people actually have some agency, that you can't change the actual event. My parents got divorced. I was in the hospital. I can't change that. But through a whole bunch of different kind of therapies and means and, somatic therapy and IFS or, cognitive behavioral therapy or ketamine or pick your, pick your therapy, that I can change my emotional relationship with the event to unwind that trauma. Is that an understanding that you have of trauma?
I mean, I'm not sure what patients he's referring to. Not everyone has that capacity to change. Unfortunately, some people are not able to get past extreme traumas in that way, just because some people do have repeat traumas and complex PTSD, and I wish it were that simple.
Yeah.
But I've seen these really unfortunate cases of trauma where people from a young age just cannot get past what happened to them, and there's this blockage, and maybe it's the type of the trauma, or maybe they genetically had predispositions to having lower adaptive coping mechanisms. But in my line of work, having treated a lot of pediatric patients and then seeing inpatient pediatric units where some of those children will likely never live outside of the hospital, I don't think everyone can get past it. And I do think that some people, and the majority of people, will be able to cope with their traumas, but not everyone can. Um, I do think that trauma changes you physically. There have been studies that show that it can impact your immune response, your cardiac response. Like some people have these horrific uh, ischemic cardiac issues where they have a heart attack and their hearts are forever changed because of their traumas. Their brains are forever changed. Um, so I wish I could say that it was that easy to, shape your adaptive coping mechanisms and figure out a way to navigate it. But I do think for some there are other barriers to that. I'm not really sure if he explained all of those other, caveats, but I do think for some degrees, for some levels of trauma, it's not that straightforward.
You introduced a concept in the book through a story with a woman that kept taking your pens, which is humorous, but related to something more serious, which is a scarcity mentality that many people have who grow up, with limited socioeconomic means, that can then that can then result in people kind of overcompensating with as a highly functioning human being because they're essentially worried about scarcity again. Can you unpack that phenomenon a little bit? Because I know this is also a little bit personal for you as well.
Well, for many of us who've come from a position of scarcity, like myself, coming to this country with very little, there was always this core fear that I would run out. So what did that lead me to do? I had to apply for every scholarship under the sun when I was in high school, even scholarships that didn't even apply to me. Like I remember I applied for this one scholarship for this Italian American football player. And my guidance counselor was like, "You're not going to get it. You're not Italian American and you don't play football." Well, guess what? I got the scholarship because no one else applied for it. So they had to give the money away. Every year they gave this money away. But I was always in this mentality of like, you got to keep working. You have to keep doing or else you'll run out. And I wasn't even aware of it, even as a psychiatrist in training, about how this scarcity trauma led me to have this fight or flight response. So it wasn't the classic fight or flight. It wasn't like the heart racing, but it was like I couldn't sit still. I had to keep working. I could never run out of opportunities. If there was a grant, I had to apply for it because what if, God forbid, I run out of resources and I didn't apply for this grant. And, there was always this fear driving me. And I think a lot of folks who have similar backgrounds or whose parents may have had scarcity, and maybe they didn't personally, but that was trickled, it was like passed down, those behaviors are passed down. There's this fear of running out, so they overwork and they hoard their resources. They don't take risks, and they miss out on opportunities in life because they're so afraid of running out. That's something I describe a lot in the book because I went through it, and I used to be very ashamed to talk about it. I went to all these fancy schools, and like I thought no one else understood, so I'd hide it. And then when I started talking about it, people were like, "Actually, I've been through that too." You'd be surprised at how many other people have a history of scarcity if it's not them personally or if their parents. And as I did the research, I started learning that financial scarcity and financial stress is one of the top stressors that people endorse in this country, right? One of the richest countries in the world, but people worry about money all the time. So we need to talk about it, but it's so taboo that people don't talk about it. And again, there's that shame that's tied to this trauma, right? The internalized, oh, something must be wrong with me, or maybe other people don't go through this because somehow they're better. But when we face it and talk about it, we can challenge it. And I still go through these periods where I start working a lot and I realize that, okay, this is my scarcity trauma rearing its ugly head again. Let me calm down because, it's not going to make me happier. This idea of having more in the bank is just that. It's an idea. It's not going to make me any happier because I'm missing out on the joys in life, like seeing my family, engaging in activities that bring me real pleasure. But this idea of having this amount, that's what I was chasing, but I'm really leaving the points of joy on the table.
Well, culture and specifically Western culture has conflated wealth and happiness in an unhealthy way, right? I mean, and of course, like, you don't even need to turn your head to see images on billboards or social media of like absolute opulence, and that's connected to happiness. And of course, that feeds that hedonic treadmill of always wanting to get the next thing, and certainly feeds the capitalist narrative. But I mean, I've traveled all over the world, and some of the most joyful people I've ever met that you couldn't wipe a smile off their face almost have no wealth. And, I count myself, very fortunate. I grew up kind of very, very middle class and sort of have remained pretty middle class. But I feel that I am most in touch with my capacity for joy in some of my toughest moments, actually. Like, my daughter was hospitalized a few years ago. It was really tough, really tough. But there was this kind of feeling of strength and connection and just presence being there with her during that time that underscored my capacity for joy in a way that, like, some great Instagram post would never fulfill. And sometimes that can be a good barometer for your capacity for joy, is actually, what do you feel like in the toughest, lowest, rock bottom moments?
I've heard that from a lot of cancer survivors as well, that they didn't even understand what joy was until they went through a scare where they didn't know if they were going to live or die, and that they view basic experiences so differently. They're so grateful, even for, like, if there's a rain that day, well, they're grateful that it rained, versus before they'd be like, oh no, it's raining today, that gratitude, I think, can allow you to connect to joy, in these very desperate situations.
Being able to almost train yourself to find beauty in the ordinary. You were talking about your mushroom sandwich.
It was really good.
It was really good, right? You found beauty in the ordinary mushroom for a moment there. But yeah, if you can stop and, this is, I think, part of your, 5V protocol, we can kind of edge into that. But to be able to cultivate the awareness of the beauty that's around you at all times, and the colorfulness and the vitality of that, to elicit a sense of thankfulness and gratitude, that can really help with this anhedonia.
Yeah. Whenever I feel like I'm feeling anhedonic, I have a theme song. It's from Hamilton. I don't know if you've seen the play, but Eliza, one of the characters, she'll sing this line, "Look around, we're so lucky to be alive right now." And it's like, it just like, I hear her singing it, and I'm just like, wow, I'm so lucky to be alive right now. Let me just try and find something, a human experience right now that I can just truly be present in. And it's nothing like super hedonic. It's, like I said, like having my mushroom sandwich outside of my office, not eating it at my desk, but literally sitting outside and eating it outside. It's a beautiful day in New York City. And it tastes better. It really tastes better outside because I'm more present. I'm not thinking about the waiting room full of patients, right? I'm thinking about this delicious mushroom sandwich on this beautiful New York City day, and how lucky I am to be alive right now. But the 5 Vs, in my book, I wanted them to be super simple so that anyone could, basically look at their hand and I use the number 5 because when I travel the world, that number comes up a lot, and I think it's because most of us have 5 fingers. But to really imagine that you're built with the DNA for joy, and to look at your hand and say, "I am built with the DNA for joy." Just forget how to take hold of it sometimes. So like you imagine reclaiming that joy by tapping into one of the 5 V's. The first V is validation. Many of us just push down our emotions and we don't acknowledge them. So get into the practice of acknowledging and accepting how you feel, good or bad. And I often liken, validation to being in a really dark room and you don't know what's happening. You don't see anything and you hear a loud crash and some of us start to panic. But if you turn the light on, you see, okay, something fell. I'm safe. So when you turn the light on your emotions and you name your emotions, that uncertainty goes down and you can actually pick the course of action that you want to take. The second V is venting. So this is expressing your emotions and you can express it verbally or non-verbally. Some of my patients write in journals, others pray, some sing, some express through dancing if they're artistic. But if you do decide to vent verbally, really be careful about who you talk to. You shouldn't be talking to your children or your employees because they're just in a lesser position of power to you and they're not going to say no. And when you do vent, be intentional about your venting. Don't just trauma dump. Really, pick 1 or 2 people that you trust and you both vent to each other. There's reciprocity there. You check in, you ask for emotional consent. You're like, hey, is this a good time to talk? And have an intention like, okay, I want to get to a resolution. I'm not just like trauma dumping and because you don't feel better after that. The research shows that you don't. And then the third V is values. We talked about the value stones. Figure out what brings you meaning and purpose. I often say if you don't know what your values are, think what's priceless in my life versus what has price tags, because at the end of the day, on your, 5 minutes left on this planet, you're not going to ask for like a Porsche. You're going to say, oh, I wish I had 5 minutes with my loved one, or I wish I could see my dog again. These are the things that are priceless. So try and tap into those. The fourth V is vitals. Take care of your body and brain because you only get one. And I go through all these tips for how to take care of your body and brain. But I think one that's super overlooked is that technology. We don't take care of our brains enough to protect us from technology. And we don't acknowledge how relationships play a role in our physical health. If you have toxic people in your life, it's really hard to have good health, really difficult. And then the fifth is a vision. How do you plan joy in the future so you keep moving forward instead of getting stuck in the past? And how do you celebrate those wins? So for me, my way of celebrating wins is at the end of the day, I'm not going to look at my computer. I'm not going to do work when I go home. I'm going to be intentional about spending time with my daughter. For others, it could be, okay, like I'm going to go for a walk through the park. How are you going to celebrate your win every day? Figure out what it is. And usually it has to do with what you value. So with my patients, I'll say, well, what does your value stone say? Okay, well, that's what you're going to plan in the future. That's how you're going to celebrate your win. And so the 5 V's can be used by pediatric patients, adult patients. They're super easy. I would not recommend doing all 5 at once, 1 or 2. You don't want to overwhelm yourself. And the goal is to become incrementally happier. So you're getting more points of joy. And if you can get your mind into that practice of I'm getting these smaller doses of joy, these smaller points closer to happier, that's more attainable than holding your breath for this big idea of happiness, this big event to happen. And if you can shift your focus that way, that is way more hopeful, more attainable and achievable.
Beautiful. I have a wonderful co-founder who is a dear, dear friend, and we are venting partners as well. And he'll just Slack me. Sometimes it'd be like, can we have a convention? And that means, I know what it means. That's our secret code for he just needs 2 minutes and I'm like there for him and he's always there for me. And we just allow ourselves to sort of express freely and we always feel great and we end up laughing generally and just diffuse the situation. And then we realize, oh, that wasn't that big of a deal in the first place. And so it's really, I'm very, very lucky to have a partner like that. And And yeah, we have a little code word for it. But I think, for me, as you talk about that, what I really love to do at the end of the day is cook with my partner for my kids. And they're diminishing around here. We've gone from 5 plates to 4 plates to 3 plates. We only have one left in high school. But having that time where all the technology goes away, and we're just present with each other. We're playing music generally in the kitchen, and even cleaning the dishes becomes actually like a ritual where we just enjoy family time, and that feels, and it's just a little thing, but we've built it in as a habit, and it's a really profitable one for the family and for feeling joy. I guess my last question for you really is kind of a personal one, is that you were able to identify this whole field of like high functioning depression and then write a book on it. And then, of course, get booked on a million podcasts and have to function at a very, very high level, with family life, with being in practice. Have you been able to take your own advice as it pertains to functioning at a high level, but also maintaining mental health?
Well, yes, and with lots of help. So I talk about this in my book a lot, how I've asked my team and my friends and my family to really help me. For me, when I get so thick into these high functioning patterns, it's really hard to slow down. But they'll tell me, they'll say, you have to stop. You have to slow down. We see what's happening. And I'm very fortunate to have them, because if they didn't do that, I just wouldn't. But if you don't have someone in your life to do that for you, there are ways that that you're not doing well, right? Like, you listen to your body. For some of us, it's the back pain, or it's the nails not getting done, or it's the grinding of our teeth, all of these things, or it's our pet, making that sad face at our feet, or it's our plants in our homes dying, right? There are always these tells. So don't ignore them. Listen to those signs. They're there for a reason.
Well, thank you so much. I think you're just an absolutely fabulous communicator. I also just love following you on social media. You just have a ton of fun. I know that you actually teach that professionally, so I believe. And it's just, it's always fun. I'm always learning new things about whining and dancing and Labubu dolls and all the rest of it. So thanks for doing serious work, but also having some levity to it, because I think we're in this moment where we need to laugh, and we need to have a good time and connect. And you do a great job balancing that yin yang. So thanks a lot.
Thank you for having me. It was just a pleasure speaking with you.
Thanks so much for listening to my conversation with Dr. Judith Joseph. You can get a copy of her book, High Functioning, wherever books are sold, and you can follow her on Instagram. It's a treat at Dr. Judith Joseph. For more of my weekly musings, like today's episode on health and culture, ad-free episodes of this show, and live streamed conversations, head over to my Substack at jeffkrasno.substack.com. I also want to let you know about our Commune course platform that contains over 3,000 lessons and practices from the world's preeminent integrative medicine doctors, health experts, and fitness, yoga, and mindfulness teachers. It is a repository of recipes for holistic well-being. So check it out for free at onecommune.com/try commune. And as a reminder, the audio version of my new book, Good Stress, is available on Audible, and you can listen to it for free as part of your premium Spotify membership. If you prefer the old school analog option, well, you can purchase a dusty old scroll at goodstress.com and get a bunch of goodies thrown in, including $900 worth of courses with some of my biggest influences, including Doctors Mark Hyman, Zach Bush, and Gabor Mate. Of course, feel free to reach out to me directly with comments, questions, and criticism of the constructive variety at jeffk@onecommune.com. Okay, that's all from the Commune for today. My name is Jeff Krasno, and I am here for you.